Okay, so this is how I do a typical hand examination in my clinic. I don't think this is particularly standardized. I think I'd like to suggest that this is a fairly standard way of examining hands. I get a lot out of this way of doing it. So I can do this on Zoom as well, but I do a sort of shortened version on Zoom. So I will see how long this takes. I ask patients to basically do this. When I ask them to do this, I'm looking at dorsiflexion. I'm looking at the dorsal skin creases. I'm also looking at the whole forearm and the elbows. And I'm looking at whether the fingers are flat. Sometimes flexes are slightly tight. And this way, with palmar flexion, you can see little ganglia that occur at the back of the wrist sometimes, and you can see that they've got normal flexion. Also, you get a vague idea of shoulder movement and elbow movement while doing that, and you've got good flexion there in the elbow. And when you turn the hands this way, you can often see the contour of the thenar eminence and the hypothenar eminence. You can see where the patients have full supination, where they have a decent span. You see the end of the thumb. And then keeping the elbows tucked in, if you do the supination first, you can then get on to pronation, and you see whether the patients have a full range of pronation or not. And then I come into this position, and when I do this, I ask the patients to see if they can get their nails into the palm crease like that, right in the palm crease like that. And sometimes that's a bit difficult for people. Get the thumb over the top, and then do a sort of first part of the Finkelstein's test with ulnar deviation and see if the patient's got ulnar impingement here. And whether they've got de Quervain's tenosynovitis with thumb inside like that, fingers over the top and over to the side like that. And in doing that, I also then sort of ask patients to show me their palm. You can see my Dupuytren's contracture, and also look at their span, see whether they've got a nice 90 degrees between the index finger and the thumb, and see what the angle between the thumb and the little finger is like, and whether they've got a square hand deformity as the base of the thumb is sticking out a little bit. And see whether their abduction's okay, whether they've got any hyperextension appearing in the thumb. And actually then I ask patients then to reach across to Kapanji position 10, see if they can reach that skin crease here. Often good to find out how much flexion angle there is at the MCP and the IP joint. And then flip the hands around, looking for Heberden's, Bouchard's nodes, and Garrett's pads at the back of the hand. And then I come on to my hand examination where I basically palpate and ask them to come to the arm wrestling position. And I start off with the distal part of the scaphoid and Watson's test. And then I feel the FCR, and then I'll come around to the de Quervain's tendon, the anatomical snuff box in here, and then round to the back of the wrist where there's often some dorsal radial impingement underneath the second extensor compartment, or central dorsal impingement here, feeling for a small ganglia perhaps. And then crepitus in the wrist, and then come around to the other side of the wrist, feeling ECU tendon, and do the provocative tests such as asking the fingers, see if we can keep the fingers apart and see if there's any tenderness or subluxation in the ECU tendon. I test the distal radioulnar joint, the pisiform, and then I have a feel in the ulnar gutter for the TFCC in here. And then I'll do the ulnar grind tests. I'll push down on that and pronate and supinate the hand, having a feel inside here, see if there's any crepitus around the TFCC. If it's indicated, I'll sometimes test the patient's intrinsics and see if they can get their intrinsics fully stretched like that, not only getting the IP joints to 90 degrees, but also hyperextending the MCP joints and see how tight those intrinsics are. And then if you want to go further, of course, you can have a little look further up the arm, for full elbow extension, and then check the shoulders, etc. But essentially that's it, and that's about 3 minutes.